Dentist offices in Western Mass have been given the green light by the American Dental Association to reopen for teeth cleanings and elective procedures as early as May 18th, unless the governor orders otherwise. But they'll be following new guidelines with increased safety measures. Western Mass News reporter Sabrina Riley spoke with a local dentist to get answers on how they're preparing for their new normal.
For the past 2 months, dentists in Western Mass have only seen patients on an emergency basis.
We have been closed down in dentistry. We have been able to support our local medical colleagues in all the local hospitals here in the Valley.
Dr. Vincent Mariano is the owner of EMA Dental and president of the Valley District Dental Society. He tells Western Mass News that while doing minimal work for the past 2 months, local dentists have been donating PPE to those on the front lines.
I am so proud of our members, over 350 of us here in the Valley. We got together and produced something like almost just over 500 boxes of PPE to donate to local hospitals.
And while they've had several emergency appointments, in just a few weeks, their workload is expected to increase with routine appointments.
May 18th, as it stands now, will be the date that we'll be able to do it. I mean, let's face it, it's been now over 2 months that elective dental care has not been done here in Massachusetts. Those 2 months, we have had a lot of dentistry that hasn't been done. The dental concerns of patients are getting worse, and I think we're putting so many patients in jeopardy by not getting to it.
And while they're preparing to open their doors to more patients, unless Governor Baker orders otherwise, they'll do so with new precautions.
When a patient comes back to see us, they're going to see a totally different experience.
And that experience will start when you call to make an appointment.
We have put together what we call a layered approach to our safety. The first layer is certainly pre-visit. A call will be made 24 hours prior to the patient's visit. They are to answer a number of questions to be sure that they are symptom-free.
The second step is when patients arrive. Rather than waiting in the office, they will wait in their cars. Then a member of the staff will meet each individual to take their temperatures before taking them into a room.
The third layer of safety is in the operatory, where all of the different protocols, safety protocols of masking, protective gear, will be taking place at that time. We also will be doing personal spacing guidelines. So the offices that we've seen before, our scheduling will be stretched out and much different. So it'll be a much less volume of patients within the practice at one time.
And beyond all that, they're also deep cleaning the entire building every night using a fogging process.
In my 35-year career, I've never seen the level of protocols and safety that have been initiated in dentistry, and certainly the levels that we have gone beyond here at EMA.
And while these new procedures take a little more effort, they tell Western Mass News they're willing to do whatever it takes to keep everyone safe.
It is our job in the leadership of our offices and in dentistry to make sure that we can communicate to our patients that they are going to be safe.
In East Longmeadow, Sabrina Riley, Western Mass News.